Shoulder pain. What kind of pain can there be? What can hurt there? What diseases can occur? In this particular area, the joint surfaces can also gradually wear down, and as a direct result, significant inflammation can develop and sometimes even a painful tearing can occur. We work carefully up to the very edge of pain, not going deeply into the pain or into acute, sharp pain. There is often trauma in this specific area. Arthrosis of the head of the humerus frequently develops. Accordingly, I assure you, after this, you will feel much better. Hello friends, today we are on the Healthy Movement channel. My name is Maksym Mamchur, I am a physiotherapist and I am also the co-founder of the Healthy Movement Center network. Today with me is Vlad, on whom a bit of anatomy is illustrated. And today, together with you, we will discuss a rather interesting topic, shoulder pain. I will explain what kinds of pain can occur there, what exactly can hurt, what diseases there are, and accordingly, which exercise is appropriate to perform for each specific disease or condition. So please don't switch off, watch until the end because every exercise is important. And even if your particular pain feels exactly the same, it absolutely doesn't necessarily mean you have the identical diagnosis as someone else you may have previously talked to or perhaps shared your personal experience of shoulder pain with. So don't switch off, it will be interesting. Friends, let's take a closer look at our shoulder and try to understand what exactly can hurt in it. Look, here the humerus bone itself is clearly and distinctly drawn. Accordingly, sometimes it unfortunately happens that a significant and noticeable arthrosis develops in the head of the humerus itself. Arthrosis is, let's say, a disruption of the integrity of the cartilage tissue of the head. This happens firstly due to some kind of injury that was chronic, lasted a long time and developed, or for example, due to poor nutrition. Similarly, for example, there might have been overloading, the muscles were spasmed and the nutrition worsened. Against this background, arthrosis developed in us. That's the first point. Second, there can be inflammation of this small joint, which is called the acromioclavicular joint. In this area, there can also be wearing down of the joint surfaces, and accordingly, pain may appear. Next, for example, there may be significant trauma to the long head of the biceps. It might seem that everyone commonly thinks the biceps only bends the arm, but actually the biceps also effectively lifts our humerus upward, playing a crucial role in shoulder movement. And accordingly, if we get trauma to this head, if we get some kind of injury in this area, it can bother us, it can hurt, and it might seem to us that the biceps has nothing to do with it, but in fact it's the specific shoulder that's hurting and causing discomfort. Next, a very interesting and clinically relevant muscle is the supraspinatus muscle. Accordingly, when it is constantly rubbing and experiencing friction in this particular segment, and when its vital nutrition is consistently and significantly impaired, a noticeable roughness or irregularity appears directly within the muscle tissue itself. Against this background, it can become inflamed and sometimes even tear. This can be an impingement syndrome, and accordingly, some trigger points may be present in the infraspinatus muscle as well as in the teres muscle. Here they are shown. Similarly, this can radiate to the scapula, to the arm, and cause its characteristic pain. Today, we will go through which muscle is responsible for what, when this pain occurs, during which movements it appears, and accordingly, what to do about it. Our shoulder hurts. We need to understand which exercise we should perform. To figure this out, you need to properly and fully realize exactly what hurts. Let's start with the biceps, specifically the long head of the biceps, which attaches directly to the shoulder joint, and because of this, we may feel pain. What do I ask you to do? Place your arm in this position, bent at the elbow. Here, ask one of your family members to press down while you push your arm upward. Let's try it. At this very moment, if you happen to feel pain approximately in this specific area, right here, you can clearly see the tendon drawn here. Accordingly, this may strongly indicate that there is an injury in this particular area. What exercise are we going to do? Let me show you. Take a bottle of water. You can use a 0.5 liter one, the smallest size. Stabilize your arm. Hold the bottle in your hand and move within the range of motion up to the point of pain. Don't push into sharp pain. Work like this. We don't bend the arm, we just keep it very firmly fixed at the elbow joint and simply lift it directly upward. This way, the long head of the biceps will be effectively working. Accordingly, we will significantly improve the blood supply to it, and the healing and recovery process of this head, if it was indeed injured, will happen much more rapidly. We do 25 repetitions. Take a pause another 25 repetitions, then pause, and a third set. After that, I typically take a cold compress and carefully apply it to this specific area for literally 10 to 15 seconds to effectively reduce any potential swelling that may occur after diligently doing these exercises. Now let's move on to the second important exercise. If you've recently had an X-ray and you have confirmed osteoarthritis of the joint itself, then please do the following exercise. Take a bottle in your hand. The heavier the better. It can be a 1 liter or a 2 liter bottle of water. Stand in this precise position and perform gentle, rhythmic, and controlled pendulum movements with your arm. Don't tense it, just let it swing like a pendulum. What does this do for us? The weight will gently pull your arm down, thereby creating significant decompression in the joint itself. That's precisely why I always say the weight should be as heavy as possible. And with these continuous pendulum movements, we will effectively improve the nourishment of the joint itself. Each time, you can gradually increase the amplitude. And the second element, we do the pendulum in precisely the same way, but now moving inward. This can be 15, 20, or 25 repetitions of each movement. But always remember, each time we gradually increase the amplitude more and more without ever going into sharp pain. However, in every session, we try to push further and further into the sensation of pain. So if we have pain approximately in this particular area, or for example, in this specific area, it could potentially be impingement syndrome. What is impingement syndrome? The infraspinatus muscle can potentially rub against the adjacent bone in this specific area. And as a direct result, let's say, this noticeable roughness often occurs directly within the ligament itself, which subsequently leads to painful inflammation. They also frequently occur together with arthrosis of the acromioclavicular joint. Accordingly, the pain may appear as a general discomfort against this background. What exercises are we going to do now? So let's get into a position like this. Again, take a bottle of water, bend your arm a little slightly to the left, and then using your shoulders, slowly and deliberately move your arm out to the side. You will start to feel pain here. The higher you raise your arm, the more pain you will feel. At first, we work up to the edge of the pain without going deeper into it or provoking sharp pain. Our primary goal in these early stages is simply to maximize the essential nourishment of this specific area, thereby effectively reducing the persistent pain syndrome and significantly decreasing the inflammatory processes occurring within that region. Perform this beneficial exercise for approximately 20 to 25 repetitions, completing 3 full sets. And now the next exercise. We stand next to the machine. I recommend you simply approach a wall, take a towel, and as much as your range of motion allows up to the point of sharp pain, raise your arm like this along the wall, lift it up, then return to the starting position. Do not go into sharp pain. And accordingly, I think that at first you won't even be able to reach the point of sharp pain, but always go as far as your full range of motion allows. Avoid any sudden movements. Do not rush, but with each subsequent time, with every training session, try to gradually increase your range of motion. Each time, we gently raise the arm a little higher and higher, perform 25 repetitions, completing 3 full sets. After that, do precisely the same, take a cold compress, or you can conveniently grab something cold from the freezer and apply it directly to your shoulder for about 10 to 15 seconds to effectively reduce the swelling that naturally forms there after diligently doing the exercises. And accordingly, if you feel pain roughly in this area, ask one of your family members to palpate it for you like this, just to check it by touch. If you feel that the pain is localized at a specific point, let's say, for example, I found that it hurts right here, and your family members confirm that this is where it hurts. What do we do next? Place your hand in this position with the thumb pointing outward and simply move your arm away from your body. Return to the starting position. Keep your elbow pressed in. We don't move the elbow away, we hold it in place, and at the same time, we perform this kind of rotation with our shoulder joint. As a result, our infraspinatus muscle is working and it is addressing its trigger points. Do 25 repetitions like this, 3 sets, and the next element, what are we going to do? And the next element, we simply take a ball. It can be a tennis ball. Find the exact spot where you feel the most significant pain, place it on that spot, press firmly against the wall, and simply roll the ball slowly and deliberately. do a self-massage like this. Just about 5 minutes, no more time is truly needed at all. For 5 minutes, just stand, press against the wall, and work your shoulder. This works through that trigger point. Accordingly, I assure you after this you will feel much better. So my dear ones, I truly think you very much indeed enjoyed our content. You will finally give us a like, finally subscribe, and share it with your friends. You can clearly see what a truly beautiful picture we've carefully painted for you so that it would be absolutely clear and comfortable for you to diligently do the exercises we thoughtfully provide. If you haven't subscribed to our channel, please do so right now. Hit the bell so you can be the first to know about our exercises. There's quite a lot of interesting content. Leave your comment. Maybe you have some questions. And until next time,